We asked you to make sure you'd recorded some headlines that we could take away. Some of you had a facilitator help you with that. Not everyone did. Can I ask those, I think these two tables that perhaps didn't, to make sure that you leave behind some headlines. Let's just take a kind of couple of quick headlines. Piers, who wants to, do you want to? I'm going to have to walk all this way to you. I'll give you the microphone. I'll go and get another one. There you are. Do you want to just
Thanks, Nigel. So the biggest one was around primary care transformation. Obviously needs to be pretty all-inclusive, CCGs, conversation between CCGs and NHS England, but also the Let-Bs and the councils. And how do we actually get that happening? Do we create a joint commissioning forum? There was talk of doing that across the 6 CCGs in the southwest, but a recognition also that it needed to happen at a more local level. So there was quite a lot in that. It needs to be linked to the call to action. And then various other things about some really interesting observation that we have very little about children today in terms of integrated care. So the sorts of joined up working we're talking about, but that needs to apply to children and adolescents as well. Various other concerns about the integration fund. So the share of the 3.8 billion, how's that going to work out? What's the time frame? And then the implications of the care bill, which are still not yet fully understood by all the local authorities, let alone by the health organisations. So I guess those are the four main things, yeah?
Yeah. Excellent, okay. Perhaps we'll just, time's rapidly upon us, Hilary. Perhaps a headline?
A big theme about integration, really, which wouldn't surprise you from North West London, and the need for the political decisions over securing a healthier future. And really just something about patients as partners, changing the role of the healthcare professional and developing the home as a place to deliver care.
Okay, so that's good. What's yeah, do you want to go to South East? And let's take South East, and you come to here for North West.
Thank you. Similar themes to other tables. We actually spent quite a lot of time talking about how tricky it was in the North East to begin with, so getting quite good at diagnosing the problem. I think the sort of fracturing the system was a theme, so therefore what's our response to that, and that we needed to find ways of working together across all the different agencies to get a clear vision for what we want, setting out in terms of outcomes what we're trying to do, and then recognising at a local operational level some things might look different, so it won't be one size fits all, but if we can get the vision sorted and the planning footprint right, then we've got a half decent chance of doing something about it.
Do you have enough time to come together to have those conversations?
We're going to make it now, aren't we? Yes.
Thank you. Yeah. Is time to have these conversations an issue in your systems? Actually being able to get people together?
Conversations repeatedly on several different...
Right.
I think there's an efficiency to have them once.
So maybe we ought to have them once. Yeah, okay. Thank you.
So on this table, relationships are good, so a good basis for collaboration going forward. A number of important enablers to get right, really. Some of those include contractual accountability being really important, as well as clarity on risk share arrangements, and something really important about making sure we keep an eye on the longer term rather than getting bogged down in short-term problems. So examples were things like looking at clear 5-year plans and exploring more than 1-year contracts.
Yeah, this theme about getting the contracts and the incentives right has come up again and again. I suppose one of my reflections is just listening to some of the excellent work, for example, in Greenwich, listening to what needs to happen in primary care. The scale of some of the change is very big, and I'm struck in a lot of places as you go around the country at the number of different projects that people are trying to do simultaneously, and often with very limited management capacity. And in fact, multiple projects are pending onto people's jobs. So I think there is a general, listening to the size of this agenda, question in my mind about being able to focus a bit and perhaps choosing a few big areas. The other thing, I think, the debate that was raised by Adrian Bull, I think isn't here, about in the primary care one, which is, oh, you are here, which reminds me of a debate we have a lot in this type of area of health policy, which are we trying to do intelligent design or evolution? Because the attraction of intelligent design is we can do one, let there be light. Here's the model. The danger of that is we may not be clever enough to design a model. We may not be able to design one that works everywhere. And if we get it wrong, we get it wrong on a very big scale. The problem with evolution is it takes a long time, and on the way there are some dodos. And there's the odd mass extinction event. So it's not always, neither path is particularly... so what we really need is some kind of intelligently accelerated evolution, at which point my metaphor breaks down. But I think a change model, over to you, Anne, yeah? A change model which says, here's the, we've worked out, I'm very clever and I've worked out the answer, I think is one to be very, very careful of. Over to you. Yeah.
So just a few reflections from me. So I was very struck, for those of you who were with us when Mark Britnell was with us earlier today. I'm not sure if he's still with us. I think he's gone, which is this challenge to us that we could spend an awful lot of time continuing to define the problem. And as I said earlier on, the first report defined the problem in 1892 in London, so it's some time to do something about it. So the other reflection that I have on today is about capacity for change. So what we've described is really, really, really difficult stuff to do, and those parts of London that have made progress have put huge capacity at the back of doing it. So we can go through a process of developing 5-year plans which are aspirational in terms of how we'll manage all of the challenges, but the real question, I guess, in my own mind is how are we going to build capacity to drive change? And I guess my last thought is how much of our personal time as leaders are we going to put at driving that change? So it simply will not work if people go from here and develop 5-year plans and then they set up a programme office and ask them to deliver transformational change. That isn't going to happen. When you look across London over the last few years, I was telling some people this earlier today, you can look at some simple metrics and say, over the last few years, on average, how much of the productivity that has come through providers has come through the tariff, and how much has that been influenced by the control on pay? And about 75% of that has contributed to providers' bottom lines. And when you look at PCTs and you look at what was the average amount of their QUIP programmes that were targeted at contract leavers, it's about 70%. So that's what's happened in London over the last 3 to 4 years. So that's how efficiency, in inverted commas, has been driven in the system. So we're now talking about transformation, and that scale feels to me as if that's a significant leadership task. It doesn't feel like one that can be delegated to anybody else than the people in this room. So I think there's a big question for us all about how we are going to make our time to give it personal leadership. The last thing I want to say is this is the first of one of these events. Thank you to colleagues at KPMG who've been very generous in their support of us in this event. We're planning to have another series of these in about 3 to 4 months' time. Your feedback in what worked, what didn't work, what you'd like to hear is really, really, really important to us. So there are feedback forms, so please fill those out. If you're not that minded, please ping me an email or one of the team. We really do want to get these events worthwhile.